This is CGTN, China Global Television Network.
Welcome to part 2 of our special program on China's new phase in the fight against COVID-19. That's called Moving Forward. I'm Liu Xin from Beijing. I'm pleased to be joined for the details from Beijing by Dr. Xiao Yiming, former chief expert on AIDS at the Chinese Center for Disease Control and Management, and a current member of the Vaccine Task Force of the central government's COVID control mechanism. From Washington, D.C. by Dr. Kate Tulenkel, CEO of the health workforce company Covis Health and former vice president of IntraHealth International Health Systems Innovation, and from Singapore by Professor Wang Ling Fa, emerging infectious diseases at the Duke National University of Singapore Medical School. Welcome to the program. Professor Wang, what are you seeing, or what are your biggest concern, and do you see those concerns being addressed by the measures taken by the authorities here?
Yeah, so I think maybe I'm a more basic biologist. For me right now, at least from where I sit, the biggest concern worrying is that with such a large number of people getting infected and the people with different immunity, so we talked about the aged population, non-vaccinated, and we talked about immunocompromised people, and we talked about people have been vaccinated, and boosted more than 12 months ago. So learning the lessons from the emergence of, the Delta and Omicron, these are the populations that we have to really keep a very close eyes to make sure that, first of all, hopefully no, new and more transmissible or even more pathogenic variants appear, but scientifically, it's almost a certain we have new variants. So I think that, coming from that angle, I think at least, publicly, we feel like China maybe need to do a little bit more on this, what we call the molecular epidemiology, that not only focus on, Beijing, Shanghai, and Guangzhou. So in these fever clinics in the remote area, if they can coordinate nationally and then send the samples to CDC or whatever, I think we need to a large number, and also we need to continue this for months. I don't think that we can say the wave is close to end. I think, I cannot predict that there will be a new wave, but definitely it's not ending. So to me, that's the number one as a scientist, that at least in the public domain, I have not seen enough being done. And I hope the Chinese government and also the scientists and the clinicians have a network to address that. This is very important, not only for Chinese, the community, but also for international community.
Right. So Dr. Xiao, first about medical supplies, what kind of steps have been taken by the Chinese authority to step that up, especially compared to 2 years ago?
I think there are three about internationally approved anti-COVID-19 drugs. China developed one, also approved by China FDA. So there are 4 drugs can be choose to use. I heard the production of that or importation of that has been scaled up. So all hospitals can get access to that drug with the doctor's prescription, and also other drugs, medications like fever drugs and antibiotics, maybe with secondary bacteria infection have been prepared, and also hormones and all the other ones to reduce inflammation. They are available. In response to Lin Fa's concern, I think for any region or country has a surge infection, the international community, the concern, first concern is there a new variant coming out? I have checked this morning. So in the last month, we have Chinese scientists have delivered about over 700 sequences of this wave to the GSAD, the International Data Bank. So that work will be continue and increasing.
does it mean that China has detected 700 different variants of the virus?
I mean the sample from 700 over 700 people who are infected in this wave. So you have to sequence the virus full length. So that's a lot of work. So with over 700 from this wave delivered to the international database, it'll help the world to know what kind of virus are circulating at the moment. I saw the CDC, the press briefing data. They have not yet detected any new variants. Yeah. They are all the variants circulating in the world before this wave. Yeah. They were being introduced into the country. So many the BF7 and BA5.2, BA5 variants. So we have not yet detected new variants. There are also some BQ1 and the new US surging variants that they have been introduced, but they have not been spread inside China yet. Mm-hmm.
You mean the XBB variant? Because XBB, we have
BQ variants. They have been detected, but not spread inside the country.
Okay, because we have this report from DW, which talks about the United States, for instance, having a prevalent XBB.1.5 since January, for instance, it's estimated to be over 50% of the cases of infection. But Dr. Xiao, do you foresee that XBB variant will become a prevalent variant in China in the coming weeks?
Because they are introduced later, only recently. I mean, among the 700 sequences, they have only found in the international traveler, not in the Chinese epidemic region, not yet.
Not yet.
XBB is so infectious, it's only a matter of time before it's in China. And my prediction is it will become the dominant strain in China. A study was just done in the US where they studied the wastewater from airplanes in the US, and over 95% of the flights had COVID in the wastewater.
Is China monitoring wastewater as well, Dr. Xiao? I understand they are doing this.
I have to check, but I think they should doing that.
Okay. Well, what about medical staff? I mean, the short of hands, according to some media reports here in China, in Chinese, was actually the number one problem, because the medical staff, in contrast to what happened in Wuhan in the very first few months, the medical staff this time bore the front of infection, and they have to treat other people as well. So what is the situation in that front, Dr. Xiao?
I think we have a very devoted and I mean the medical professionals in China. So there are about 8 million of them. They have been played a very important role at the beginning of the epidemic. At the ending of the epidemic, they are working very busy at the moment. And I heard many different departments of the hospital have converted into a respiratory department to helping colleagues to take care of patients.
In terms of the mortality rate, I want to ask a little bit more, because that is one of the major topics on some international media, even from the very beginning. At this moment, Dr. Xiao, do we know the case fatality rate? China is not yet given any number about deaths yet. Help us understand what is the criterion of China's count of deaths, either because of COVID or with COVID. What is the China practice so far, Dr. Xiao?
I'm not familiar with that because I'm in the task force of a vaccine. I'm a main scientist, not a clinician. But I heard from the news, maybe like you, we have in the recent news briefing, we contributed to the COVID deaths is many the COVID infection plus the respiratory disease and failure So in that case, maybe the patient died of cancer and heart attack, as other implications will not be counted as a COVID death. I heard from the news briefing, yeah.
China's currently defining COVID deaths differently from how WHO defines it. WHO defines a COVID death as a death above the average, for that time period, whereas China's currently defining it as deaths from respiratory causes for people with COVID. But we know that COVID kills people through other means, for example, blood clots and kidney failure or general sepsis. So you don't have to die from respiratory failure to die of COVID.
Let's hear what Zhao Yahui, head of the Bureau of Medical Administration under the National Health Commission, said on December 29th about specifically this issue.
On the one hand, China insists on making all-out efforts to treat the disease and reduce the number of severe cases and death. On the other, when death cases occur, we have a pathway. If the person tested positive with a nucleic acid test, that case is then reported as a COVID death. If the person didn't take the test, the cause of death is reported in the system by China's CDC. If it's a death case, we report and publish the information according to the Chinese law, which requires such procedure. We're insisting on the principle of truth and openness in releasing information.
Professor Wang, what is your gauge of this practice by China?
Yeah, so this, I think, is, I will not say controversial, but it's a different criteria, as Dr. Kate has said, to me personally is that I think you should, I don't mind that you have two reporting systems, but what I'm most interested is at the death of the individual, if that person is COVID positive. Because whether the COVID is the direct trigger of the death or not, medically, scientifically, you can debate, because as Kate says, COVID can trigger, cardiovascular, other non-respiratory syndrome, which can lead to death, but it's still caused by COVID. So to me, it's kind of too academic, and I think I would prefer to see a system just reporting, how many people are positive at death. This is just, I think, an important number to have, and then we can debate about, what caused the death, because it's really important. The hospitalization right now, I think, I don't have the number, but I have, relatives living in China and friends, most people go to hospitals fever, and more than 90% of them are COVID positive. So some of them, unfortunately, will die. And we can debate, as long as we wish, whether they died of COVID or died with COVID. Yeah. But I think it's very important to know that the surge of hospitalization is triggered by COVID infection.
I was in a hospital yesterday, and I was in a respiratory disease inpatient department, and I talked to the head doctor there. They had, since the outbreak of this particular wave, they had 96 people hospitalized because of COVID, and out of them, 7 people died. So that's 7 out of 97. And for him, of course, he's not in the ICU. For him, that is the number he has. But Dr. Shao, I want to ask you, so China will eventually publish a number. Is that going to be the case? And what is the difficulty of China in tallying a number that is reliable, that is as close to the truth as possible?
I'm not I mentioned I'm not a clinician, and I'm not, I joined the task force is on vaccine. So I'm not the right person to answer that. But I think there are scientific methods afterwards to measure the actual death cases more reliable. It's called excess death evaluation. WHO had did that last year for the first 2 years of COVID. I think in the future, because when you are in an emergency, your main task is to saving lives, care patients. So there are scientific methods, established methods. We can later to evaluate that and to get the right number.
there's no right or wrong way to define a COVID death, but you want data to be comparable. And the fact that China is using a different definition from every other country in the world means you can't compare the data. So that's the challenge. So we would like everyone to use the same definition, right or wrong, because then you can really track how things are moving.
Agree.
Well, at this moment, I don't know exactly whether China is the only country using that particular criteria, or whether, how is deaths collected in other countries. But as Dr. Xiao said, I think that right now the focus, and everybody understands, is on saving lives. Yeah. Eventually, we will come to a fuller picture when, the priorities is being met at this moment. I want to move on, if I can, to the kind of caution other countries are taking to arrivals from China, whether Chinese citizens or other travelers. Some countries have expressed concerns, but the European Center for Disease Prevention and Control, in the beginning of January, they made the statement that the variants circulating in China are already circulating in the EU, and as such are not challenging for the immune response of EU citizens. In addition, EU citizens have relatively high immunization and vaccination levels, so a surge in case in China is not expected to impact a COVID-19 epidemiological situation in the EU area. Professor Wang, do you think it is reasonable or it is necessary for some countries to adopt, a specialized measure vis-a-vis arrivals from China at this moment?
I think, I've been paying close attention to this, and most countries is doing that as a very extremely precautious measure. The real concern, as I said, is the worrying about emergence of a new variant. Although I think, Dr. Shaw already said the data so far does not suggest there's a new variant, but clearly variant takes longer than just 3 weeks, right? So that's why I think the other countries are doing that. And I think, it's controversial because even for certain countries, the government is taking such a arrival test, and then the medical and epidemiologist basically says, that test is not going to really prevent. Even if China has a new variant, that test, is unlikely to change the fact that if there's a new variant, it will be spreading. So I think, COVID taught us a lesson. It's not only just science and medicine, there's a politics, there's others. So I personally feel that I can understand both sides. The side argue for a test, I think is really trying to say, in case there's a variant, we'll detect early. The side argue for not to have a test to say, even if there's a variant, that test will not 100% prevent it. So, I think my personal view is that it's really country by country. And during the last 3 years, we have seen such kind of policy. It's not uniform, but each side has their own kind of merit.
Yeah. Dr. Tulenko, as we said, in the United States, now the prevalent case is XBB.1.5, which is extremely, virulent, which spreads very, very fast. And yet it seems that there is no particular screening or restriction to arrivals from the United States. So what's the worry about travelers from China?
Well, I think that, there's this concern that is China being treated differently from any other country. And I don't think it is. It's just that China is in a different phase of its COVID pandemic than other countries. For example, when I traveled last year, I had to test, before I went because, the cases were much higher in the US. Now that they're lower, I don't have to test. So it's just about the phase of the epidemic that China is in. That being said, there can also be political involvement as well, but I think it really is more about the phase of the pandemic, because once again, U.S. citizens had to be screened when they went to most countries in the world just 8-9 months ago.
Yeah,
Dr. Xiao?
This reminds me about early last year. I was consulted for should we put a special testing or quarantine treatment to people from African countries about 1 year ago when Omicron just appeared. My suggestion is that the variants is going to come out all the time. So we should not a special single out certain country, certain variants. There's no scientific basis for that. So China didn't adopt the special restriction to African travelers at that time. I think we should not politicize of the epidemic control. We should solely rely on scientific data and evidence.
All right. Once again, remind us, Dr. Xiao, what kind of challenges is China faced with moving forward? Is there still a learning curve? And as the Spring Festival travel season coming up, which is in a week time, or basically already starting in some places, and this is the first time after 3 years of many people not being able to reunite with their family, what is China bracing for at this moment?
I think the day before yesterday, they have a special press briefing. I heard that for the traveling, they expected about 2 billion people times travel during the Chinese New Year. They are doing preparation for rail, air, and highways, and they give a lot of instruction to how to mitigate this wave, and also further prevention, even though it's very difficult, but still try to control the spread of the virus with masks and with hand cleaning, and also with temperature checking. Even though we do not use the health code anymore, but temperature checking are still easy. Managed measures are still used. I think health education and is very important. So I think the different government departments are doing all the preparations. Many people in big cities has also personal experience, so they understand. I mean, the understanding is much better than before this wave. So I think formally, in my observation, is many government dominated control measure. Now is become a citizen dominant control measures combined with government preparation and guidelines.
Yeah. Professor Wang, going forward, how much optimism do you have looking at the different customs, different culture of the Chinese society? Because everywhere I go, for instance, everybody is still wearing masks.
Yeah.
So how optimistic or how pessimist are you about the next weeks to come?
I think, from the sudden surge of the infection, so the herd immunity is now a dirty word, right? At the beginning, we were wishing for herd immunity, either through natural infection or vaccination. But in China, I find it's really interesting. It has never happened in the last 3 years in other countries, because in China, most people are primed with an inactive vaccine. And this has been going on for the last 2 years. And then with the last 3 weeks, suddenly you have an infection, really spread so fast. So to me, it's a new, actually, I don't know if Kate will agree. In the whole world, we have not had that situation, inactive vaccine priming. Basically now, instead of getting a booster vaccine, you boost with a natural infection and 80% of the population in one go. So if you want to be optimistic, barring the emergence of a new, more transmissible, more virulent vaccine, I think China may get out, I think, a bit easier than others because it's synchronized. So again, I don't want to say herd immunity, but it's like the herd boosting was synchronized, okay? All right. So barring from a very different variant, and now the Chinese New Year is coming, so there's another boosting coming, basically for the very few remaining naive individuals, they will be infected in the next 3 weeks. So I think we will see, by end of Feb, we will tell if they get out, relatively safely, or the hospital just collapse, could not handle. So I cannot predict, but I'm leaning towards basically that a synchronized boosting by live virus vaccine infection without emergence of a more virulent strain, then I think by end of February, we will tell that if China has survived this sudden surge.
Just want that one final detail, Dr. Xiao. Do we know the rate of infection yet? I mean, the estimate, because Professor Wang talked about 80%. What is there a quasi-official estimation at this moment?
I have not familiar with that surveillance task force work. I think they will give out that maybe in the near future. But from a personal experience, we can, I mean, from a small environment, maybe 2/3 about the people around me have been got infected. But they're still, because that is sampling of working class. There are some older seniors, they don't come out, so a real number is difficult. We have to wait for the surveillance work with more data support.
Okay, we have to leave it there. Thank you so much for all of this great information and insights. Hopefully this will help, and hopefully that China, with the help of all sectors of society and government, we will ride out this wave, this initial wave successfully. Dr. Xiao Yiming, Chief Expert at the Chinese Center for Disease Control and Prevention, Dr. Kate Tulenko, CEO of the health workforce company Corvus Health and former Vice President of IntraHealth, International Health Systems Innovation, and Professor Wang Lingfa, Director of Program of Emerging Infectious Disease at the Duke National University of Singapore Medical School. With that, we come to this special program on China's new phase in the fight against COVID-19 that's called Moving Forward. I'm Li Xin from Beijing. On behalf of the whole team, thank you for watching. You've got the point.
Facing the unknown is always difficult. In a world in turmoil, it's easy to lose orientation. But when the storms come, we have to see the possibilities. Reinvent. Find new opportunities. Discover a path forward. CGTN. See the difference.